Gruesome to Humane. Hello and welcome to my podcast. I'm Macy and we are about to take a deep dive into the history of what we know as medicine today. A quick disclaimer before we start: if you are eating, you may want to stop before I continue. If you have a weak stomach and are not comfortable with some detailed medical procedures, this may not be the podcast for you. At the beginning of a new topic, I will display photos on the screen. Viewer discretion is advised. In this podcast, I will be highlighting American innovations of treatments, surgery, and discovering what lays under the surface. First thing we are going to cover today is the question, why? Why were pharmaceutical treatments, amputations, and autopsies created? Well, disease arose, and people wanted to cure them. Smallpox, anthrax, bubonic plague, and tuberculosis are all diseases that were cured by the invention of the vaccine. War occurred, and people sustained injuries. Sometimes those injuries were better cut off, I guess. After amputation or injury, people wanted something for the pain. Let's just say things were dirty. An infection may or may not have occurred. So antibiotics and sterilizers were made to stop infection. For those unlucky patients who passed from infection, coroners and medical examiners had their back, or their whole body. Autopsies were also performed to learn about disease and human anatomy. I think it's time to get more specific about these topics. Pharmaceuticals and treatments. Pharmaceuticals changed dramatically from the 1700s to the 1900s. The invention of vaccines was a huge step in the innovation of medicine. The Immunization Advisory Center states that Edward Jenner is considered the founder of vaccinology in the West in 1796, after he inoculated a 13-year-old boy with vaccinovirus, cowpox, and demonstrated immunity to smallpox. In 1798, the first smallpox vaccine was developed. After one of the first American vaccines was created, they started to develop more efficient ways to administer them. In 1853, Charles Gabriel Perez and Alexander Wood developed one of the first syringes. Medical advancement kept growing, and more vaccines were made. After 1850, vaccines for cholera, anthrax, rabies, typhoid fever, bubonic plague, and tuberculosis were created. Okay. Let's just say pharmaceuticals were somewhat odd during the period of time between 1700s and the 1900s. In an article written by Robin Walsh, she wrote, Pfizer was founded in 1849 by two German immigrants, initially as a fine chemicals business. Their business expanded rapidly during the American Civil War, and demand for painkillers and antiseptics rocketed. Bayer Pharmaceuticals, which was a very large and one of the first pharmaceutical companies. Some of the first painkillers are now considered very illegal. Two of the most common painkillers in the late 1800s were cocaine and heroin. Crazy, right? Cocaine was even advertised towards children, and heroin was used to relieve coughs. There are not many regulations on pharmaceutical and chemical companies. Walsh writes, these companies focused as much on cod liver oil, toothpaste, citric acid for soft drinks, and hair gel as on prescription medicine, as well as selling products like heroin on over-the-counter market. There was no line between chemical companies and pharmaceuticals. This caused chemists to experiment with chemicals and how the human body reacted to them. Anesthesia was the result of this. Welcome to the beginning of anesthesia. This anesthesia was not anywhere close to today's version. It was used when doing amputations and surgeries, which is still true today. The type of anesthesia was very different, though. Dr. Mary Williams writes, in 1846, the first record of using anesthesia was made, just 15 years before the Civil War. Chloroform and ether were the anesthesias used during the Civil War. Bob Shepard wrote that it was estimated anesthesia was used at least 125,000 times by surgeons for both North and South, who before the war had limited to no experience with anesthetic agents. Chloroform was poured on a cloth and put over the nose and mouth of a patient until they rendered unconscious. Ether is a combination of alcohol and sulfuric acid. On the ranch where I live, we use ether to help start tractors in the winter. When using these types of anesthesia, sometimes patients would wake up in the middle of surgery, and some wouldn't wake up at all. There were many weird forms of treatment from 1700 to 1900. During the evolution of America, weird treatments were created. Treatments such as snake oil, lobotomies, and bloodletting. Snake oil was a treatment used to reduce inflammation and treat arthritis. There was a cowboy named Clark Stanley, aka the Rattlesnake King. Brian Holland wrote, Stanley claimed to have studied with a Hopi medicine man who turned him on to the healing powers of snake oil. He took his knowledge to the Chicago's World Fair in 1893. He would grab a rattlesnake and he would cut it open and squeeze out the oils. Holland continued, that didn't stop other unscrupulous doctors and fraudulent salesmen who also started traveling in the American West, peddling bottles of fake snake oil, giving truly beneficial treatment a bad name. Another odd treatment is lobotomies. A lobotomy is a form of psychosurgery, a neurosurgical treatment for mental disorders that involves severing connections in the brain's frontal lobes from the thalamus. Walter Freeman performed the first lobotomy in 1936. In the beginning, Freeman would drill holes in the top of his patients' skulls. Holland explained the rest of the process, later evolved into hammering an ice pick-like instrument through their eye sockets to sever connections between the frontal lobes and thalamus, which he believed to be part of the brain that dealt with human emotion. Walter Freeman and James Watts worked together to practice lobotomies on cadavers, then performed their first lobotomy on a living subject in 1936. Lobotomies were used to alleviate pain and distress from the mentally and emotionally ill. This was only successful sometimes, and other times people had relapses, or they were permanently damaged, or in the extreme case, they died. Holland describes one of the victims of lobotomy. One of the most infamous victims was Rosemary Kennedy, the sister of future President John F. Kennedy, who was left emancipated and spent the rest of her life needing full-time care. Lobotomy was not the only treatment that had detrimental effects. Bloodletting is a treatment that has been around since ancient Egypt. In an article by Janie Cohen, she describes 18th century bloodletting as bloodletting as a medical procedure became slightly less agonizing with the advent in the 18th century of a spring-loaded lancet and the scarificator, a device featuring multiple blades that delivered uniform set of parallel cuts. Bloodletting was also done by placing leeches near very veiny areas such as the forearm. The goal of bloodletting was to flush out any illness by bleeding. The first president of the United States had bloodletting done. In Cohen's article, she says, on December 13, 1799, George Washington woke up with a bad sore throat and began to decline rapidly. He asked to be bled the next day, and physicians drained an estimated 5 to 7 pints in less than 16 hours. Despite their best efforts, Washington died on December 17th, leading to speculation that excessive blood loss contributed to his demise. He passed away after having bloodletting done because he had strep throat. In the 1800s, other medical innovations started taking over and pushing bloodletting out. Amputation. 1861 through 1865, the Civil War. One of the most gruesome times in medical history. Many battle wounds that needed to be taken care of. But were they taken care of properly? The short answer is no, it was gross. Let's start with sanitation. There was no concepts of germs or bacteria. Dr. Mary Williams writes in her article, Medicine of the American Civil War, sterilizations of instruments did not occur. And when instruments were wiped off, it was often on soiled surgery aprons, soiled cloth, or even surgeon's dirty bootstrap. And what do you know? Infection and disease occurred. A thick white pus would form on most incision areas. At the time, they thought this was a good sign. It definitely is not. Everywhere in the hospital that you could think of probably had some form of body fluid contaminating it. Gross. In Williams' article, she also explains how 2/3 of Civil War deaths were caused by infection and disease, not the wounds themselves. Not to mention, there were buckets of limbs outside hospital tents during war. The tools they used looked like a toolbox: saws, clamps, scalpels, and many other terrifying tools. Some patients were lucky and survived surgery and infection, but some were not. Autopsies. Autopsies are a form of dissection in order to discover information about a human. Rogojinski and Ventral were pioneers of autopsy. In an article by Hem once, they describe American pioneers of autopsy. William Osler, who studied with Rogojinski and Ventral, popularized the use of autopsy in America. Osler performed autopsies in the mid to late 1800s. Joseph Guillardo writes, many pioneers in internal medicine, such as Sir William Osler, performed autopsies because they were anxious to see for themselves the internal derangements that might explain their patients' symptoms and death. Over the century, many advancements were made and autopsies improved. New technology allowed new generations of medical examiners and coroners to learn the mistakes of the past. Guillardo writes, in 1910, Richard Clark Cabot compared patients' records and autopsies and found about 40% of clinical diagnoses were inaccurate or incorrect. Advancements like these allowed future generations of physicians to learn and continue to make growth in the field. Overall, major advancements were made in the 1700s to the end of the 1900s. During those years, a large turning point happened in American medicine. Treatments that were used are now considered unconventional or illegal. Gruesome tactics for surgery are no longer used, and now hospitals are one of the most sanitary places to be. It's a huge difference. In the world of autopsies, knowledge continues to grow and develop. This creates a larger amount of accurate results from autopsies to find answers of what happened to the body. Medical advancements are made every day, but a huge change in the years 1700 to 1900. Thank you so much for joining me today while we investigated the turning point of American medicine. I hope you enjoyed seeing what's under the surface.